This is one of the most misunderstood parts of the female body, yet it plays an important role in health, protection, and reproduction. Understanding the vagina, structure, and purpose. The vagina is a flexible, muscular canal that connects the outer genital area, the vulva, to the cervix, which is the lower part of the uterus. On average, the vaginal canal measures about 7 to 10 centimeters, 3 to 4 inches in length. But what makes it remarkable is its ability to expand and contract depending on the situation, whether during exercise, intimacy, tampon use, medical exams, or childbirth. Its inner walls are not smooth. Instead, they contain tiny folds called rugae, which allow the vagina to stretch without injury. These folds are similar to the expandable design of an accordion. The vaginal lining is made of soft tissue rich in blood supply, giving it a healthy pink tone in younger individuals and sometimes a slightly darker tone after puberty due to hormonal changes. Another powerful feature is self-cleaning. The vagina naturally produces fluids that remove dead cells and bacteria. This is why medical experts advise avoiding harsh soaps or internal washing douching, because it can disrupt the natural balance of protective bacteria and lead to infections. The vagina also maintains a slightly acidic environment, which acts as a defense system against harmful microorganisms. The hymen. What it truly is. The hymen is a thin, stretchy membrane located just inside the vaginal opening. Contrary to popular belief, it is not a sealed barrier. If it were completely closed, menstrual blood would not be able to leave the body. Instead, the hymen usually has one or more openings that allow normal bodily functions. Scientifically, the hymen is considered a remnant of fetal development, meaning it forms before birth and does not serve a major biological function later in life. However, it may provide minor protection in early childhood by limiting the entry of bacteria. Natural shapes and forms of the hymen. One of the most important truths is this: there is no single normal hymen shape. Every body is unique. Common natural forms include annular hymen. This is the most typical type. It forms a ring around the vaginal opening. Crescent-shaped hymen. This shape looks like a half moon and leaves a larger natural opening. Septate hymen. A thin band of tissue runs across the opening, creating two small holes instead of one. Cribriform hymen. This type contains several tiny openings similar to a sieve. Microperforate hymen. The opening is very small, which may sometimes require minor medical treatment if it interferes with menstrual flow. Imperforate hymen rare. Occurs when there is no opening at all. This is uncommon and typically identified during adolescence because menstrual blood cannot pass. Doctors can easily correct it with a simple procedure. Appearance and changes over time. The hymen is elastic, not fragile. Many everyday activities can stretch it gradually, including sports such as cycling or gymnastics, using tampons, medical examinations, normal physical movement. Some people are even born with very little hymenal tissue. Because of this, modern medicine agrees on an important fact. The hymen is not a reliable indicator of virginity. There is no medical test that can prove whether someone has had intimate activity based on the hymen alone. The vagina during growth and adulthood. As puberty begins, rising estrogen levels make the vaginal walls thicker, more elastic, and better lubricated. This prepares the body for reproductive maturity. During arousal, the vagina lengthens and widens in a process called tenting, allowing comfort and reducing injury. Perhaps the most extraordinary moment is childbirth, when the vagina stretches far beyond its resting size and later returns close to its original structure thanks to powerful muscles. Why this knowledge matters. Understanding the true science of the hymen and vagina helps eliminate harmful myths that have caused emotional distress for many people worldwide. These organs are not symbols of purity or shame, they are examples of intelligent biological design. Every woman's anatomy is naturally different, and variation is a sign of health, not abnormality. When people are educated, they make better health decisions, seek medical care confidently, and treat their bodies with respect rather than fear. Knowledge protects, science clarifies, truth empowers. And the more we understand the human body, the more we appreciate how carefully it is designed for protection, adaptability, and life itself. If you found this educational and exciting, please subscribe, like, and comment your thoughts below. Tell us, what part surprised you the most?